Hello and welcome back, and today's videos is on tummy tuck. I'm Dr. Ankit Gupta and I get a lot of queries about tummy tuck and liposuction, and patients are not able to differentiate between those two and they always get confused between which is good for them, either liposuction or tummy tuck surgery. So today I'll be focusing on tummy tuck. I've made a lot of videos on liposuction of the tummy area. Today it's a different topic. It's tummy tuck, and which is also called as lipoabdominoplasty, and I'll be discussing a lipoabdominoplasty with a case that we have done recently. So this young lady, she's a mother of 3 and she had this tummy. She inquired us about liposuction, and when I examined her, and I would like you to see as well, muscles, they are split and they are far apart. There's a bulge in between and the tummy is protruding out, and whenever she used to do her lunges or she used to raise her legs, this portion of the upper portion of the tummy used to bulge out. It means that the muscles in the center, they have separated, and this is called as diarification of recti, and this would need repair of the muscles. This is not hernia. This is not a gap in your tummy. It is just that during pregnancy or childbirth, due to increased pressure in your tummy area, the muscles, they get separated and they are to be joined back. Till the time I do not join back these muscles, I do not stitch them back together, this deformity or this shape cannot come back to normal. Plus, if you can note, there's a lot of extra skin in the lower tummy area, and this is all because of childbirth. When a lady gets pregnant, because of the baby inside and because of the increase in the volume of the tummy area, there's a lot of increase in the skin. After delivery, 70 to 80% of the skin would shrink back. It also depends on what age you had your pregnancy. If the pregnancy was at a later age, usually the contractile power of your skin is less and the skin is not able to contract back to its original size. With increasing ages of pregnancy, this issue is very common these days. With twin pregnancies and all those in which the tummy is overly stretched, this issue is very common of loose skin. So with liposuction, I cannot stitch the muscles together. With liposuction, I cannot remove the loose skin from beneath. For these two issues in particular, one has to go for tummy tuck. Tummy tuck is a surgery which is also called as lipoabdominoplasty. Lipo is liposuction, abdominoplasty is tummy tuck. What we do is that we remove the fat from the back, that is liposuction, of the whole of the back area, of the love handles, that is the side areas. So this is me marking the areas from where I would be removing all the fat. So this is the cut from where we would take out all the fat from below. And in the front area, I would mark the midline where we would want to stitch the muscles together, and your belly button would be transferred to a normal position. So what happens is, when I remove all the skin that is below the belly button would eventually come down to your pubic area. So I have to make a new position for your original belly button. So we just mark the area, and the cut that we give to remove all the skin is in the pubic area. It is called as the bikini line scar, because the final scar would be in the area where one usually wears a bikini. That is why it is a bikini line scar. And this whole thing that I have marked is the skin that we will be excising. So all that skin is excised, and the sides we liposuck. I'll show you what we have done for this lady. So this, in the final marking, as you can see, this is the whole skin that we are going to remove. This portion we are going to liposuck. The muscles are separated in this area. We have to bring both these muscles together in the midline, and this is the whole surgery. So I won't show you the actual surgery, but this is the amount of skin that we were able to take out from this lady. This is the amount of skin, total amount of skin that we have removed from the lower tummy, and I would show you after 2 days how she is. Now if you can appreciate, the tummy is now, it has gone in, all the loose skin is gone. Only a scar would remain, which is usually the scar at the level of your cesarean section if you had one, or it is just in the panty line or a bikini line. So this is how you would look after 2 days, and this swelling would eventually go down even more. The liposuction has been done on the sides as well as on the back. This is still not the final result. There is a lot of swelling, and it almost takes 1.5 to 2 months for all the swelling to subside down. So we'll be updating the final results of this lady pretty soon. You can follow our channel for the final results. But this is what is tummy tuck. This surgery would take around 4 to 5 hours in total, in which we would do a 360-degree liposuction, along with that removal of the skin as well as stitching of the muscles. The recovery time is a bit longer compared to liposuction. The recovery period would at least need 1 to 2 weeks off from your work. Usually 10 days is sufficient, after which you can join back work if you have a sedentary lifestyle. Exercising and all, you are not allowed to do cardio and all for about 1 month. After about 1.5 months, you can go back to your normal schedule, normal routine, because once you have stitched your muscles, we do not want you to strain too much, otherwise the stitches will break. Ideally, one should get tummy tuck done once your family is complete, because if you get it done before that, you won't have any issues in pregnancy, but it's of no use. If you again get pregnant, again you will have an increase in the size of your tummy, and the whole process will have to be repeated again after your pregnancy is over. It should be done at least 6 months after you have completed your lactation, or at least 1 year after your pregnancy is over, because for up to 1 year the skin shrinks on its own. You should be ideally healthy. So in case you wish to know more, you can always contact our team and we'll be happy to help you. Thank you and have a nice day.